Good evening, doctors. Welcome again. This is a orthopedics MCQs subject wise. Let's discuss. In a case of reimplantation of amputate digit, which of the following structure is fixed first? Here it's bone. We have to fix first bone. See in details. Reimplantation of amputate digit procedure. Debride the area and clean the wound. Okay. Then fixation bone, repair of external extensor tendons, then repair of flexor tendons, atrial repair first, then nerve repair, then venous repair, then closure of skin wound. I hope it's clear for you explanation. Now, agent which decreases the bone reabsorption in osteoporosis are all except tripartite. Let's discuss. This is the diagram. Now, drugs which reduces the bone reabsorption, anti-reabsorptive drugs are selective serotonin receptor modulator is raloxifene. Bisphosphonates are etidronate, residronate, pamidronate, alendronate. Okay. Hormone replacement therapy, estrogen, calcitonin, calcium supplements, vitamin D, denosumab monoclonal antibodies which inhibits the maturation of osteoclasts by binding and inhibiting the rankle. The drug which increases the bone reabsorption bone formation is tripartite. Drug with both effects decrease bone reabsorption and increase bone formation is strontium ranelate. I hope it's clear for you. Next question. Blood supply to head and neck and femur is mainly from middle circumflex femoral artery. Let's discuss. The blood supply to the head and neck of femur comes from extracapsular atrial ring located at the base neck of femur, artery ligamentum teres, epiphyseal arteries and metaphyseal arteries. The extracapsular arterial ring is formed by posterior branch of middle circumflex, major part of blood supply, lateral circumflex, smaller branches of superior inferior gluteal artery, the both medial and lateral circumflex, femoral, and branches of profundus femoris. Artery of ligamentum teres is a branch of obturator artery. It contributes a small amount, variable amount of blood supply. Okay. Now, which of the following is a characteristic feature of Blount's disease? That is xenovarum. Xenovarum. Okay. Sorry. It is named after Walter Putman Blount, also known as tibia vara, Mao-Nielsen syndrome, Blount-Barber syndrome, Erlacher-Blount syndrome, osteochondrosis deformans tibia. It is a growth disorder of a tibia resulting in progressive low bow leg deformity. It is also associated with internal tibial torsion and genu recurvatum. It is mainly seen in children and adolescent. Treatment bracing and or surgery. Okay, I hope it's clear for you till here. Now move on next. Agnes Hunt traction is used for flexion deformity of hip. Okay, yeah. See, the traction used for trochanter fracture is Russell traction, trochanter R fracture. Okay, traction for fracture shaft of femur is for adult Parkin. Femur F, do one line Parkin traction. Traction used for low back back B and Buck's traction B. Remember. Now, trade of Klippel-Feil syndrome consists of all except low hairline, short neck, limited neck movements, but no elevated scapula. Okay. Yes, discuss. Elevated scapula can be seen as a part of Klippel-Feil syndrome, but it does not constitute the characteristic trait. Okay, I hope it's clear for you now. Brown tumor is characteristic of hyperparathyroidism. Let's discuss. Brown tumor occurs due to the increased osteoclastic activity. In hyperparathyroidism, it is a benign mass of reactive tissue. Okay, let's move on. Which of the following is tested using the lift of test, that is subscapularis? Okay, now let's discuss lift of test, also known as Gerber's test. Used to assess the function of subscapularis muscle. For performing his test, the arm is extended and internally rotated so that the dorsum of hand rests on the lower back. The patient is asked to lift the hand of the back. This requires internal rotation of arm brought about by the subscapularis. If the patient is able to perform the maneuver, the subscapularis function is normal and the test is negative. Okay. Now, all are true regarding synovial sarcoma except more common at extra articular sites. Yes. Knee and foot are commonly involved. Yes. Usually seen in individual less than 50 years of age. Yes, but not originate from synovial lining. They are asking except, so answer is this. Let's move. Discussing. Originates from synovial lining. The name of synovial sarcoma is misnomer. It does not arise from synovial lining. The name arises from the fact that the histological resembles synovial tissue, most commonly seen those between 15 and 35 years of age. Males and females equally affected, most commonly seen in lower limbs around the knee and foot. It is a slow growing tumor with indolent course. It may be aggressive in later stages. Okay, now clavicular fracture is treated by figure of 8 bandage. Okay, let's discuss. Clavicular fracture heals with good functional result even if there is moderate displacement of the fracture end. Perfect reduction is not essential. Treatment consists of figure 8 bandage which is periodically tightened. A sling can be used initially to support the upper limb. In case of elderly patient with risk of axillary neurovascular compression, only a sling is used instead of figure 8 bandage. Okay. When reduction is done in case of non-union neurovascular damage, floating shoulder and wide separation of a fracture ends with interposition of soft tissue. Okay. True statement about involucrum and sequestrum. Sequestrum is a dead part of bone which is surrounded by involucrum. It's a pus-like tissue. Explain. Sequestrum is surrounded by involucrum. Okay. Sequestrum is a piece of dead bone, as I told, in chronic osteomyelitis, surrounded by infected granulation tissue, trying to eat away the bone. The outer surface of this bone is smooth due to erosion, granulation tissue, and inner surface is rough. Okay, now it is a dense sclerotic bone surrounding the sequestrum. It has holes, drainage of pus, its cavity lined by infected granulation tissue, involucrum. Okay, now Hiberden's arthropathy affects the distal interphalanges and PIP involves Bouchard's arthropathy. Okay. Now, Hiberden's notes seen in distal interphalanges join characteristic features of idiopathic osteoarthritis. Remember. Now, in Klippel-Feil syndrome, the patient has all of the following clinical features except low hairline, bilateral neck webbing, gross limitation of neck movements, but no bilateral shortness of sternomastoid muscle. They are asking except, so this is an answer suitable here. Now, most common nerve injured in a supracondylar fracture of humerus, that is anterior interosseous nerve. In older studies, the radial nerve was found to be the one most commonly injured, but recent studies have shown that the median nerve, particularly the anterior interosseous branch, is the most commonly damaged in supracondylar fracture of humerus. Okay. Gallows traction is used for. Gallows traction is used for fracture shaft of femur. Okay. Bone remodeling in response to stress was described by Julius Wolff. Okay, Julius Wolff. Now discuss. Bone remodeling in response to stress was described by German anatomist surgeon Julius Wolff in 1836 and 92. In 19th century, Wolff's law states that the bone in a healthy person or animal will adapt to loads it is placed under. Nicolas André 1658 and 1742, a French doctor, coined the term orthopedics in his book. He gave the illustration of the cork tree, which was later used in the symbol of many orthopedic society around the world. Okay. Now, a joint is inverted by the articular branches of a nerves which supply the muscles which move the joint. The law is known as Hilton's law. Hilton, remember. Joint is inverted by the articular branches of the nerves which supply the muscles which move the joint. Hilton's law. The fibrous capsule is the most sensitive part of a joint. Pattern of nerve supply to the capsule of the joint. The area of the capsule is stretched during the action of a muscle. Is supplied by the articular branch of the nerve which supplies its antagonist. For example, the part of capsule, the hip joint, and is stretched during abduction of a hip is inverted by the obturator nerve which supplies the adductors of hip. This acts as a safety mechanism which helps to prevent injury of the joint. Okay. Now, most common sequel of a tuberculous spondylitis in adolescent is bony ankylosis. Okay, all tuberculous joint except spine usually heals with fibrous ankylosis, whereas in all spinal joints bony ankylosis is same. Okay, a young woman met with an accident and had mild quadriparesis. Her lateral X-ray cervical spine reveals C5 C6 fracture dislocation. Which of the following is the best line of management? Cervical traction followed by instrumental fixation. Instrument fixation. Let's discuss. The fracture is unstable injury because there is a dislocation and neurological deficit. The initial management should be close reduction and traction. Definitive management is instrument fixation after spinal cord edema is decreased. Okay. All of the following are true about fracture of atlas vertebra except atlas. First cervical is Jefferson fracture is the most common type. Atlanto-occipital fusion may sometimes be needed. Yes, CT scan should be done for the diagnosis. Quadriparesis is seen 80% cases. This is not true. They are asking except answer is this. Usually there is no neurological damage in atlas fractures. All of the following areas are commonly involved in sites in pelvic fracture except ischial tuberosities. Ischial tuberosity fracture is the rarest among the options given. Expansilytic osseous metastasis are characteristic of primary malignancy of kidney. It includes kidney, lung, thyroid, GIT, breast. 30-year-old male man had a road traffic accident and sustained fracture of femur. 2 days later, he developed sudden breathlessness. The most probable cause is fat embolism. Let's discuss why. Fat globules released from the bone marrow due to trauma orthopedic procedure are deposited in the pulmonary capillary bed. The causes ischemia and inflammation. The symptoms appear 12 to 72 hours after a trauma. Initial symptoms are tachycardia, tachypnea. There may be a high speaking fever and non-palpable petechia, especially over upper body. I hope it's clear for you. Then, 45-year-old was given steroids after renal transplant. After 2 years, he had difficulty in walking and pain in both hips. Which one of the following is most likely cause? That is avascular necrosis. And how to remember avascular necrosis? Like sclerosis, L E R O. S for steroids, C for Cassoni's disease, L E for lupus erythematosus, R for radiation, and A for not sclerosis, sclera, A for alcohol. Responsible for avascular necrosis. Which one of the following is the investigation of choice for evolution of suspected Pearl's disease? Investigation of choice is MRI. Okay. Subtrochanteric fractures of femur can be treated by all of the following methods except Smith-Patterson nail. Yeah, Smith-Patterson nail was previously used in internal fixation of fractured neck of femur. So guys, have a good day. Goodbye. That's all for today. I already finished with this orthopedics MCQs part 1. Next parts I'm going to launch. So guys, have a good day. Goodbye. That's all for today. If you have any queries, any question, you can ask me. And if you still not subscribe my channel, please subscribe it for more new updates and new videos. Thank you. Goodbye. Thank you.